How did you feel every time you looked in the mirror, you felt like you were not big enough no matter what anybody told you? It didn't matter how much muscle you had, it didn't matter how big people thought you were, you just, every time you looked in the mirror, you just weren't satisfied with the muscle that you had. You just thought you were completely small. This problem is called muscle dysmorphia. I think that people need to be more informed on muscle dysmorphia because people do not see it as an actual problem. As a bodybuilder, I can honestly say that muscle dysmorphia is a real disorder and it can take over your life. I spend all my time prepping my food, cooking my food, even staring myself in the mirror and just being not satisfied with what I see in the mirror. To learn more about muscle dysmorphia, we will cover three specific topics. First topic is the definition of muscle dysmorphia and what muscle dysmorphia actually is. The second topic will be the signs and symptoms of the disorder. And the third topic is how to treat or help people that you know that has muscle dysmorphia. To learn more about muscle dysmorphia, we'll first learn what it actually is. This disorder is a very serious disorder. It is stated by Michelle Silverman in What is Muscle Dysmorphia that it is when people, mostly males, are obsessed with the size of their muscles. Now, that's not saying that women aren't affected too, but it's more prevalent in males. Muscle dysmorphia is actually a subtype of body dysmorphic disorder. This was also stated by Michelle Silverman. And muscle dysmorphia is also known by other names such as bigorexia and reverse anorexia. I have pictures here of, they're just illustrations of a person who obviously has enough muscle mass, but when he looks in the mirror, he's just not big enough. And the same goes with this picture here. Obviously, this guy is larger than normal people, but when he looks at himself in the mirror, he's just not satisfied with how he looks. Now that we know what muscle dysmorphia is, we will now cover the signs and symptoms of the disorder. There are many different types of symptoms for muscle dysmorphia. The first type of symptom is cognitive symptoms. This is where the people hate their reflections or they have delusions of being underweight. This was stated in the diagnosis of the condition. There are also some physical symptoms such as extreme exercising, where they will just go to the gym for hours and hours and just keep exercising. Another one is lifting while being injured. Say if they sprain their wrist or they strain their anything, they will just go to the gym no matter what. And I can attest to this because I have hurt myself and still lifted at the same time. Extreme attention to diet. This is where they will weigh all their food. They make sure they hit certain numbers and eat the same thing almost every day. I have two things here. One's a scale that I use personally, and I'm always weighing my food no matter what. I weigh peanut butter, chicken, everything to the gram and to the ounce, just to make sure I'm eating what I need to eat. And I also have pre-cooked food that I always cook every weekend. Chicken to make sure I'm eating all my chicken and rice to make sure that I don't miss a meal. Another physical symptom is the use of anabolic steroids. And this I personally don't do, but some people will go to that extreme. And there was a case, his name is Drake Valentino, and he actually used steroids so much that his arms got infected and they exploded basically, and there's blood everywhere. Even though there are many difficult symptoms to deal with, there are great ways to treat and help people with muscle dysmorphia. There are a lot of different treatment options. The first type of treatment option is cognitive behavioral therapy. This focuses on teaching you healthy behaviors such as being social, going out with friends, and avoiding obsessive behaviors like mirror checking and just always looking at yourself when you walk past the mirror. Cognitive behavioral therapy also helps you learn to stop negative thoughts. So every time you see yourself, it tries to teach you to not think, oh, I'm not big enough. It just tries to help you out basically. Another type of treatment option is peer treatment option. This is where friends, family come into play. You should try talking to the person that has this disorder. If you can tell, you should acknowledge that this person has a serious problem because then it would open them up to talk about it more and everything like that. Stated by James Leon, and many others in the recognition and treatment of muscle dysmorphia and related body image disorders. they say you should encourage talking about feelings and dispel feelings of isolation. So you should, you know, encourage just everything and try and talk about the problem. There are some medications stated in an article made by CNN. One type of medication is selective serotonin reuptake inhibitors, or SSRIs, and these may help control obsessions and repetitive behaviors. And doctors also may recommend antipsychotic medication in addition. They don't really have a set medication for this, since it is a mental disorder. They just use basically the same types they would as if somebody was prescribed with anorexia or anything like that. So in conclusion, there are many different ways a person can help treat someone that has muscle dysmorphia. Muscle dysmorphia can be a very serious problem and can affect how a person sees themselves. I hope that you all have learned about what muscle dysmorphia is, the signs and symptoms of this disorder, and how to help or treat people with muscle dysmorphia. I hope that you all keep in mind all the information I've provided for you if you ever come across somebody that has muscle dysmorphia, as it is a very serious problem and can honestly take over somebody's life. So that can be all they think about and everything. Thank you for your time.